Another thing that I'd love for you guys to think about is an idea that I put together as an alternative to the Affordable Care Act. The problem in healthcare is that we have a system that's already broken. The third-party payer system is broken. It masks cost. There's no incentive to save, even with a copay or a deductible. And there's no free market where people are actually shopping for price. I'll give you a great example of how it is. My company also has a foundation. And we run some free healthcare clinics here in Tennessee, and we send doctors all over the world to do medical missions trips. We were going to Cambodia. We had 5 or 6 docs or people on the team, and we're going to Cambodia. They go to our major medical center, huge teaching facility in this city, which I'll let you kind of figure out which one that is. They go in to get their shots, and my docs call me and say, "Mark, it's $750 per doc." And now this is being paid for out of money we've gone out and raised, not-for-profit dollars. And I'm like, hold on. So I call 4 or 5 hospitals and find one that would do it for $150. Now, if my copay was $50 here, $50 here, or $50 here, what do I care? We have a system that is broken. And that's why healthcare costs, and I got to admit, I've benefited from it. I'll just admit it. I'll take my doctor hat off, I'm a senator hat, and it's, inflation in healthcare has been twice the inflation of the rest of everything else because there's no free market and there's no constraints on spending. Well, how do we fix that? There are people out there we've got to help. I mean, they're in need of healthcare. You see that person, especially if you look at it from a political standpoint, who's dying of liver disease and they don't have health insurance, and they're saying, "You dirty Republicans, you're against getting me taken care of." Well, that's not true. We're against sinking the entire ship in order to get you care. And we can't do any more debt, obviously, with a $21 trillion debt. But anyway, how do you get that person help in a system that creates an incentive to save and allows for a free market to happen? Well, what I've proposed, what we passed in our legislature this year, and we now have the letter in front of CMS, is a pilot program in the state of Tennessee. We're calling it the TennCare, the name of our Medicaid program, the TennCare opt-out. So the patient could opt out of being in our managed care plan. And they would get a swipe card. We typically in Tennessee spend about $5,000 on each patient. So we would give them a swipe card just like their food stamp EBT. And we would tell them there's $2,000 on this card that can only be spent at healthcare providers and pharmacists. At the end of this year, if there's any money left on this, you get it back as a cash earned credit, just like an earned income credit. Most of our Medicaid patients don't understand a health savings account, but they do understand an earned income credit. So now they're incentivized to not spend, and they're incentivized to save, and they're incentivized to take care of their health. And with a little bit of that other $3,000, we buy a catastrophic plan in the event that they get diabetes or have a stroke or whatever. And the physician is paid immediately. So the card is swiped, it's like a Visa card. The doc is paid, he doesn't have to file a claim. That reduces the cost of his doing business. And he gets an immediate cash flow hit. Now, I run a medical company. I've got 700 physicians working for me now. Let me tell you, I will compete for that business. And I will lower price so I can get all of those patients coming to me because it's an instant cash flow hit and I don't have to pay all the people that work in the back office. Imagine physicians competing for your Medicaid patients and lowering price because now the person is shopping for price. So this is just something for you to think about, and I have a copy of the bill back there if you want to take a look at it. Just so you know, health savings accounts decrease consumption 9%. That's what most studies say. In the state of Tennessee, that would be $1 billion savings on our TennCare program, which would allow us to insure another 225,000 people without a penny of debt to the federal government, without a penny of more money spent.